So I'm Dr. Raymond Douglas, and we're joining you from Beverly Hills, California. And today we're talking to Christina, who is a former patient. And what we really want to do is to talk and have a series of patients detailing their experience with thyroid eye disease. Because the psychological aspects of this disease, how it impacts family, how it impacts friends, and even one's sense of self-esteem can be so profound that we really want to give people a sense of hope and let other people know what really occurs, and that there is a light at the end of the tunnel. Christina, thank you so much for joining us.
Of course.
And I know that you're joining us from outside of Chicago, so it's a real pleasure to see you again, and you look fantastic.
Thank you. It's good to see you too.
Well, we can start a little bit just by maybe, talking a little bit about how you were diagnosed and how you came upon finding that you had any problems with your thyroid or your eyes, whichever you want to start with.
I was diagnosed with Graves' disease in 2006. And then just kind of controlling it with medication on and off for a couple of years. I would go into remission and then it would come back. In 2011, my endocrinologist had told me that she recommended me doing the radioactive iodine to help with my overactive thyroid. And after I had that, a couple months later, I started noticing my eyes were bulging and just didn't look normal. And I went back for a follow-up appointment with her, and she had told me that it was a side effect of the radioactive iodine that she failed to tell me about. And that's when the thyroid eye disease started for me.
Yeah. So sometimes, it absolutely can occur at a higher rate with the radioactive iodine, sometimes even just in general. But it's so frustrating, I know, when you have the radioactive iodine and get it very soon after. Yeah. Some people can take steroids, but to try to prevent it or minimize it, but it can be tough. So you got your thyroid controlled with the radioactive iodine, but unfortunately then you were left with some eye bulging. Yes. And tell us a little bit about, eye bulging doesn't sound so bad, but, we'll have some of your photos up, but it really affects everything you do. And tell us a little bit about how it affected you and how it impacted your life.
Okay. To start off, self-esteem. You just don't look like yourself. You don't feel like yourself. Severe dry eye. Just even putting contacts in, I would be driving and my contacts would fall out because my eyes were bulging so much and they were so dry. It's just very uncomfortable, but the self-esteem was like the biggest thing. You just didn't feel like yourself. You didn't want to leave the house at certain points. It was hard for me because I was trying to date at the time and going out on dates, and it's like your eyes are bulging and they're kind of like, why is she looking at me like that? Yeah. And so I would try to hide it with makeup and things like that. My sister had gotten married during the time where I had a really bad flare-up, and I would try to squint in all of my photos for her wedding because I didn't want my eyes to look like that in her photos. So it was really hard self-esteem wise, as well as just being uncomfortable all the time. Yeah. Sleeping, I couldn't close my eyes all the way when I would sleep. So I'd wake up in the morning and my eyes were severely dry. I still sleep with an eye mask just now because it's more comfortable. And I'm just so used to having like that total blackness. Okay. But yeah, constantly putting drops in my eyes, constantly had an extra pair of contacts in case they fell out, because that happened a lot. But yeah, don't miss those days.
Yeah. How long did that last for you?
I had it for 2 years before I had found you. I was ready to have surgery with another doctor who had told me that basically he could pull my eyes back in about 5 millimeters. And I just thought that was great because that was the best news I had heard. I saw many, many doctors in the Chicagoland area. And I heard from, you'll never look the way you did. This is your new normal, so get used to it, to it's too risky, don't do the surgery. And then so when this guy said, yeah, I could do the surgery and I can get him halfway back, to me, I thought that was great news. Until I saw you on Facebook, I saw a video of yours and I was like, no, I need to go see this guy before I schedule my surgery.
Yeah.
I'm so glad I did.
Well, thank you so much. But So tell me, I mean, it's frightening, even I think about it, of the responsibility, but just thinking of patients, you're going to have your surgery around your eyes. You're going to have this surgery where we're kind of doing something behind the eyes, and, it's, you kind of want to, I know a lot of my patients kind of want to know, but not know too much. Tell me what was going through your head at this point in time. You have this self-esteem issue, but you feel that it's a pretty drastic solution, having surgery.
Um, when I saw you and I had asked you, I remember I was with my mom at the appointment and we had asked you, how far back do you think you can get my eyes? Like how more like normal? And you said, they're going to go back all the way. You're going to look like your old self again. And both of us just started crying. I had pure confidence that I was going to do the right thing by having you do the surgery. I wasn't scared. I knew I was going to be okay. I knew things were I just had this feeling like you were educated enough about this disease and you knew exactly how to fix it. And so I wasn't scared at all going into the surgery. Of course, you have a little bit of, and for any surgery, you're a little bit scared, but I knew that it was the right thing to do. I knew that I was going to be okay after. And I was so excited to see what my results were going to be.
Good. And you had an amazing result. I mean, the only reason I could say that, just to be fair, was knowing how much bone you had, what the disease looked like, and things like that. And so I felt confident that we could make a really nice difference for you because you didn't have a lot of other issues going on. Not everyone is quite so fortunate, but you were, we had a lot of good things going forward for us. How was the surgery for you? I mean, it's been quite a while now. It's probably a little harder to remember.
5 years.
Yeah.
Already. I can't believe it.
Yeah.
It wasn't as bad as I thought. Especially because I did the right eye, and then a week later I did the left eye. So I know exactly what to expect for the second go around. So the second go around was so much easier.
Okay.
It really wasn't that bad at all. I was prepared with like ice packs and, the medication for the pain management, which really wasn't bad. Just did a lot of sleeping and by day 2, I felt totally fine. Like you had a lot of black and blue around your eyes, but I felt fine. I was traveling from Chicago to you when you were in Michigan. And I remember driving back with my parents and feeling totally fine. And they're like, do you want to stop at the casino on the way home? And I was like, sure. So I walked in with the casino with 2 black eyes and I felt fine. I was just trying to cover it with sunglasses so people didn't think I got beat up by someone. But I felt totally fine. And then I remember I went to go see my grandma and my aunt when I got home. It was, I think it was my grandma's birthday when I got back home. And she could not believe that I had just had surgery. And I'm walking around, eating, totally felt fine. Like the pain was not that bad at all.
That's good. And that is usually true. And you had a pretty big surgery, so I divided it into 2 stages, which I don't always do. Sometimes I can do everything in 1 stage. But you had a lot, and so we did divide it. And the pain usually is more of a dull ache and than severe pain.
Yeah,
it's usually the swelling, and you usually look a lot worse than you.
Exactly. Yes, I was just going to say that. You look like you got hit by a truck, but you don't feel like it.
Yeah, well, that's good. That's good. And you didn't have any, as I recall, you didn't have any double vision or anything afterwards. So everything went. We got very lucky, and it hasn't always worked that way, but that was very smooth. So tell me, how, after the surgery, I mean, you adjusted really well. And were you able to re-achieve some of the self-confidence and some of the, some of the real issues that you had prior to that?
Yeah. It's funny because I look back now and I'll randomly come across a picture from 5 years plus.
Yeah.
And I forget that I look like that sometimes. Or, I'll see someone out at the store with their eyes looking kind of bulgy. And I almost want to ask them, if they have the disease, just because I want to help people.
Yeah.
You don't want to, hurt their self-esteem by asking, what's wrong with your eyes? But it's like, I want to help any way I can. And it's crazy how my life has changed since then. Like, I'm not afraid to go out of the house. I don't have to try to hide my eyes. I have a son now who's got big, beautiful eyes, and people say he has my eyes, and that's a compliment now. Like if someone said something about my eyes a few years back, that would have not taken the same way. It would have almost been like an insult if someone was saying I had big eyes. So now when they're saying your son has your big, beautiful eyes, it is a very, really nice compliment.
Yeah, no, now you have a beautiful son. That's awesome. Well, and I know you've been so supportive to other patients on Facebook, and is anything else that you can tell people who are going through this disease? Again, everyone's experience is different, and we don't want to. There's nothing easy about this process, but we want to at least give people, a plethora of opinions and real life circumstances rather than just scary internet photos. Anything else that you can add to your story that would help people?
Don't give up hope. When you find a doctor that you're not comfortable with, don't stay with that doctor. Find another doctor. Ask for before and after photos. That was a big thing for me. There was a doctor I saw where I asked to see the before and after, and I didn't know which was which because you couldn't really see any results, or they wouldn't show it to you. So I want to know, how many surgeries have you done? Let me see what your work is like. Don't be scared to ask questions. And if you're not comfortable, then it's okay to, get a second opinion or third opinion. And there is hope out there. So if someone says, you can't do the surgery, it's too risky, just ask another doctor. Just see what other options you might have. Don't give up.
It is a very specialized surgery that really has changed, and yours, I know, was an outpatient surgery, which it should be. It takes an hour or two to do the surgery, but it really has changed over time. And thank you so much, Christina.
No
And
problem.
congratulations on your new 1-year-old son.
Thank you.
And so nice to see you doing so well. And we'll look forward to chatting hopefully soon.
Sounds good.